this is just the beginning.
Welcome to this Axios virtual event. I'm Mike Allen, from my home, probably to yours. I'm in Arlington, Virginia, right across the bridge from Georgetown. There's a few more boats and people and cars there than there were when we started doing these virtual events. Today, we're going to be talking about the future of telehealth. And my moderator today is going to be joining me is Caitlin Owens, who's author of our morning healthcare newsletter, Vitals. And today is Caitlin's birthday. We'd like to thank our partner, Roe, for making this conversation possible. And Caitlin and I are going to be unpacking some of the ways that technology is being disrupted in the healthcare space, particularly in this COVID moment. We'd like to thank you who are joining us on Axios.com, on LinkedIn, on Facebook, on Twitter, on YouTube, all the ships at sea. And we'd love for you to follow along at hashtag Axios Events. And on at Axios, you can check us out. Our first guest is the chairman of the Federal Communications Commission, Ajit Pai. Chairman Pai has had a great American story, has worked across virtually all parts of public life. He was an FCC commissioner, and he's worked at the Senate Judiciary Committee and at the Justice Department and at Verizon, and as a law partner and as a law clerk. Is the son of parents from India, grew up in Kansas. A great American story. Chairman Pai, welcome to Axios.
Well, so great to be with you, Mike. Thanks for the warm introduction, and happy birthday, Caitlin.
Well, thank you very much for being a friend of Axios. And you are a former high school champion debater. So it's probably not fair to interview, but just plunging in here. You've experienced telehealth in a very real way. You recently were in Salt Lake City. Take us there and tell us why telehealth matters in this moment.
Well, thanks for the question. It matters so much. And to me, it's personal as well. I grew up in rural Kansas, as you pointed out. My parents were physicians. And I very visibly remember my parents leaving early in the morning to go to a distant town to try to provide care because there wasn't a specialist who might live in those neighboring towns that would be even smaller than ours. And so now, from our vantage point at the FCC, I have a chance to make an impact to broaden healthcare access and outcomes through telehealth. And I visited, among other places, Salt Lake City, where the Department of Veterans Affairs has a national telemental health hub. And there I spoke with a veteran who was able to get remote mental health consultations that, as he put it, added years to his life, took him off medication, had made him a lot happier, made his family a lot stronger. The interesting thing was he was over 1,000 miles away in a suburb of Dallas, Texas. That is possible because of the promise of telehealth. And that's one of the things we're trying to do at the FCC is to make every person in this country who might not be able to go to a bricks and mortar healthcare facility for whatever reason, give them access through some of these broadband connections. It's a really powerful way to extend the medical expertise of some of our great healthcare professionals in this country.
And Mr. Chairman, tell us what that veteran experienced. Him sitting in a suburb of Dallas. Tell us how it works and why it works.
The way it works for him is pretty simple. His provider can get in touch with him and say, we have an opening on this date at this time. Would that be convenient for you? And he has a tablet, or he had a tablet that he was able to log onto at that time and see the specialist in Utah who was able to help him. And as I was discussing it with him and with the provider, it's better for both of them. He actually felt more comfortable in some ways with a virtual mental health visitation. And the provider found it very convenient too, because if he had a few minutes free, he could speak to people like that veteran and provide more care more efficiently in a way that was convenient for him. And I've seen that across the country in places like Lecanto, Florida, and Providence, Rhode Island, and Boise, Idaho. There's some really interesting mental health and just general healthcare professionals doing incredible work over this telehealth platform. And by and large, even if some of the patients might not be tech savvy at first, they come to love the platform because of the feel they get getting that provider to provide care virtually, but also the savings in terms of time and effort. You know, they don't have to take 2 hours off to drive to the clinic. They don't have to call their employer and get time off from work. They don't have to worry about childcare in their absence. And so those are the kinds of things that are making telehealth, I think, much more accepted in both the healthcare provider community as well as the patient community.
As part of the CARES Act, the federal government response to the pandemic, there was a telehealth fund in there that you administered. Tell us how that worked, what you learned from that process of distributing those funds.
I am so excited about this program. This is one of the things that I pushed for in early March when the CARES Act was being debated. And I told them telehealth really has a chance to shine here. Please give us authorization and funding to set up this program. And Congress did that. They passed the law, the CARES Act, on a Thursday, giving the FCC authority and $200 million in funding. The president signed that bill on a Friday. The following Monday, I presented to my fellow commissioners a plan for executing that program. And the other commissioners voted to approve it on Tuesday, the next day. So we've, since April 13th, when we opened up the window to health providers submitting applications, we've now distributed funding to 539 applicants, allocated all 200 million of that money to 47 states, the District of Columbia, and Guam. And this money is being distributed to a whole variety of institutions, bricks and mortar community health centers, mental health and behavioral health facilities, and the like. And they're providing a variety of care with awards up to $1 million. And that's already having a huge impact. Just one quick example of that is the UPMC Children's Hospital in Pittsburgh, Pennsylvania, where 2 months ago, the FCC made an award. And one of the doctors there, Dr. George Mazariegos, put a video out saying that because of this FCC funding, he was able to give a tablet to one of his youngest patients, an infant who had just had an organ transplant, to allow his parents to remotely connect with him so that the patient, the infant, who was, of course, immunocompromised, didn't have to come back into the facility and risk exposure. Just one tiny example of what a powerful program this has been. And I can't wait to see more stories like that from across the country.
So government can work fast. It's rare.
Absolutely. And this is one of the critical things that I've emphasized to Congress, and I'll emphasize to your viewers, is that to the extent that the FCC gets authority outside of the typical arcane, slow-moving, statutory-bound legacy programs that we've got, we can execute really, really quickly. If Congress has simply given us funding within our current structure, for example, even though our rural healthcare program is very effective at what it does, there are also a whole set of rules, and there's a very extended time frame, a lot of administrative hoops to jump through. And that couldn't allow us to get the bang for the buck for the American consumer that we've gotten through the COVID-19 telehealth program. So going forward, I do hope that as the Congress thinks about how to update the telehealth rules, one of the things they'll consider is giving the FCC more flexibility, giving all agencies more flexibility, encouraging states to get rid of some of the interstate licensing requirements and those kinds of things, or I think would be a helpful thing coming out of the pandemic. So hopefully we'll see telehealth even more common and more streamlined in the time to come.
Now, Chairman Pai, a hallmark of your reign, if I can use that word, has been bridging the digital divide. That's something that you and I have talked about many times over the years. That's suddenly a freshly vital topic now that so many students, pupils are learning from home. What's being done about the digital divide in this moment, and what are your concerns as we head into the fall?
I have a tremendous concern. Ever since my first days at the commission, I've said that this should be our top priority, and we've made it a priority. For example, coming down the pike on October 29th, we're having starting a $20 billion rural digital opportunity fund to get high quality broadband up to 6 million locations in rural America. We've also instituted or proposed a 5G fund to make sure that unserved parts of the country that are unlikely to get 5G wireless investment will be able to get that. That's going to be a $9 billion fund. We've also made a huge amount of spectrum available for carriers, fixed wireless companies, other smaller carriers to extend wireless access to unserved parts of the country. For the first time in 22 years, we increased the budget for our rural healthcare program that provides broadband connectivity to hospitals across the country. It was $400 million, and now it's up to above $600 million, and it's indexed for inflation. That will help broaden broadband access for some of these healthcare facilities. In addition, one of the things I'm really excited about is our Connected Care pilot program. This is a $100 million program that we started as healthcare becomes inverted, where care is provided outside of the home. What if we allowed diabetes patients and other recent post-operative patients and the like to have wireless sensors that track them in real time so that they didn't have to wait for things to become emergencies and then have to come in? That's one of the things we're looking to subsidize as well. So a whole bunch of different initiatives to close that digital divide. We have more work to do, to be sure, but we've also made some tremendous strides over the last 3 years. And I'm really proud of that. It's a bipartisan cause at the end of the day. It's not a Republican issue or Democratic issue. It's really an American issue. And that's why I call this digital opportunity. It's really the gateway to 21st century opportunity to me.
We're about to get the hook here, Mr. Chairman. My penultimate question. Let's say President Trump has a second term. If there's a second Trump term, what is the likelihood that you would stay on?
That's a good question. Well, I'm so focused on the sprint right now that I haven't had a chance to think about what I would do when I've actually had a chance to stop and catch my breath. But what I will say is I've been so tremendously honored to serve alongside all of the FCC career staff, doing incredible work on telehealth and rural broadband, getting access to technology for people with disabilities, working with some of our foreign counterparts and some of the issues that are dear to our hearts, like the digital divide. It's been the privilege of a lifetime, and I can't say enough how much I appreciate the opportunity to serve. And to me, at least, going back to your original comments, it's been gratifying to me to see the American story play out in my own life. I'm one of the most fortunate individuals to have ever served in this position, and I'll always remember that.
That's a great valedictory. Talking to some of your friends, it sounds like 4 years may be enough for you.
I don't know. I've got a lot still to go, even though we put a lot of points on the board. And we've got a lot of big initiatives coming up, 5G spectrum auctions, that rural broadband fund, for example, expanding telehealth, continuing to work with some of our foreign counterparts on 5G security issues. And so a lot of irons in the fire still. So I haven't really thought about the end point. I'm still in the middle of that sprint.
My grandmother loves that expression, irons in the fire. So you're not ruling out 4 more years.
Oh, look, I'm having a really good time working on some of these issues. I really care about them a lot. And to have a chance to see them in action in places like the Wind River Reservation in Nathidi, Wyoming, one of the last trips I did before the pandemic, and see how the FCC's policies started in 2018, allowed rural tribal members who have been on the wrong side of the digital divide for generations to finally get gigabit fiber, and to see the tribal elders, what it meant to them, and the tribal health clinic there and the tribal school. To me, at least, that is really what the FCC does best. And so I've really enjoyed the platform that we've been able to use to provide value to the American consumer.
As we get the hook here, Mr. Chairman, you know we always end our newsletters with one fun thing. We like to finish our conversations with the newsmakers by asking them about an out of work passion. And Mr. Chairman, a little bird tells me that right before everybody shut down and started working from home, you took up biking. How has biking gone for you during a pandemic?
Biking has been fantastic. I've been biking. I started biking to work last summer and kept it up even through the pandemic. It's been terrific. There's so many little nooks and crannies in Washington that you never get to see if you're on a road driving a car. In addition to that, I love podcasts and the like. And so the ability to go down, just to unwind and listen to a podcast while I'm biking safely down the Potomac River or whatever it is, it's just been tremendous. Good exercise, of course, for someone like me, who's typically sedentary sitting in front of a screen. But I highly recommend it to those folks who are interested. Biking is just a great activity, and especially in a bike-friendly city like Washington, I've been very lucky to be able to do it. And who knows? Hopefully, once we emerge from the pandemic, return back to our facility at the FCC, I'll have a chance to bike to work once again.
Mr. Chairman, hoping that that is true for everyone around our country. Wishing you and your family the best end of summer, and thank you for joining Axios.
Well, thank you so much, Mike, for the work that you do, and really appreciate you, Caitlin, the entire Axios team for having me on to discuss an issue that's really a personal passion of mine.
Great. Thank you, sir. We'd like to thank our partner. We'd like to thank our partner, Roe, for making these conversations possible. And now we're going to go to Axios CEO, Jim Vandehei.
Thank you, Mikey. Very much appreciated. My pleasure to have a conversation now with Zach Ritano, who is the CEO of Roe. For those watching who are not familiar with your company, explain what you do and why I would come to Roe.
Yeah, absolutely. Thanks for having me. So Roe handles everything from online diagnosis to the delivery of medication to ongoing care. We have 3 digital health clinics. We have Roman for men's health, Rory for women's health, Zero for smoking cessation, and we actually recently released Roe Pharmacy, which is a cash pay pharmacy where we offer over 500 generic medications, all for $5 a month. Every single medication is $5.
And I would come to you because it's cheaper, or it's more efficient, or it's more of the moment in terms of the digital technology?
Oftentimes, all of the above, right? So when we take a step back and say, what problems are we solving? Roe, from our perspective, there are 2 large underlying issues in the U.S. healthcare system, and everything we do cascades from there. The first is that the system is not designed to incentivize people to build for what patients want and need. And the second is that there's a structural imbalance in the healthcare system. There's too many patients and too few providers. On the first part, the reason it's not built to incentivize people to improve patients' life and build for really what they need is that patients don't control the flow of money at the point of purchase. They're unable to tell the market what matters to them most. An example of this, a perfect example is Oscar, right? They recently released a $3 formulary, an amazing initiative with such a big heart. And I used to be a member when I was a consultant. They were unable to offer this $3 formulary to patients in New York, California, New Jersey, and they were unable to do it for contractual restrictions. So here you have an insurance company that wants to reduce the price of life-saving medications for their members and are unable to do so. We don't think that an environment that would let that happen, right, is an environment that leads to innovation, that leads to what's best for patients. And on the structural imbalance side, right, there's too many patients, and we could not educate enough providers in the time period that we need to make sure that everyone gets the high quality and affordable healthcare that they need and deserve. And as a society, the only way we've ever been able to do more with less, right, leverage an expert labor force, is to use technology, from the iPhone to the printing press. And so our philosophy here is to build technology to empower providers, right, to allow them to practice at the top of their license to treat patients, and to frankly allow them to treat more patients, right? So it's a very uncomfortable feeling for people to internalize, to say the only way that we can get everyone the healthcare they need and deserve is to actually change the ratio, enable doctors, pharmacists, nurses to treat more patients. And we can do that by actually enabling them and giving them superpowers through technology. So that's what Ro has done. We're a cash pay, digital, national digital doctor's office, national pharmacy, perfectly integrated, but we are cash pay where we serve patients. If we stop adding value to their lives, we go out of business. And we're building the technology to enable them to do that conveniently and as accessible and affordably as possible.
Everybody's dealing with the coronavirus. I assume it's had profound implications for your business. What are the biggest changes that you're seeing as a result of the virus, and especially ones that you think have durability, will last beyond the moment?
Yeah, it's a phenomenal question. So I think everyone in the industry would have obviously hoped for a different reason for either a new understanding or new appreciation for telemedicine, right? So some of the changes that we've seen, and unfortunately it's really been brought on by an international pandemic, right? But we've seen, hey, sometimes, not always, it's really great to allow patients to text, have phone calls, have video chats with their doctor, right? I've been video chatting with my grandparents for 10 years. We shouldn't have needed this moment to say that, hey, this is a good idea, and to prevent a 65-year-old from driving an hour to talk to their doctor for 12 minutes. But now that it's here, I think that the willingness to try telemedicine, the ability to approach that digital-first mentality, to say, hey, can telemedicine work for me? And if not, maybe in person is better. And to have those things work in harmony with one another, have telemedicine unburden the existing healthcare system, have it eliminate unnecessary in-person visits. And the other thing I think we saw is from a regulatory perspective, I think we've seen some really amazing changes, right? We've seen the FCC invest in rural access, right? What COVID has done in so many ways is it's shined a light on all of the problems that have existed in the healthcare system for quite some time. And I think, frankly, we're embarrassed by it. But it's good because hopefully it will serve as a catalyst. We see the racial inequities, right? We see the geographic inequities. And for Ro, for example, we've treated patients in 96% of care deserts. So I think what you'll hopefully see that will be a lasting change is the willingness to try telemedicine, seeing it as a complement, not a replacement. And really, hopefully, having this serve as a catalyst for united really efforts around those key issues that I described before to improve and really give everyone the healthcare they deserve.
You spend a lot of time thinking about insurance, thinking about the healthcare system. What will insurance look like for me as a buyer 5 years from now if things play out the way you think they'll play out?
Yeah. So at Ro, we actually think that for the majority of healthcare needs, insurance is it's a horrible financial vehicle for the majority of what people need. And the main reason is that insurance is fantastic, but not for everything. Insurance is great when an event satisfies all three of the following criteria. It needs to be rare, so cannot happen very frequently. It needs to be uncertain, may or may not happen at all, and it needs to be expensive. Your house burning down, someone getting, you or your family getting a rare disease. These are things that it makes sense for us to pool risk for. We do not buy insurance for gas, a predictable expense. So what I think you'll see is that the majority of healthcare, what people need, it shouldn't be that expensive, right? 9 out of every 10 drugs are generic and they cost pennies to make. So the majority of what people need should be, it's predictable, right? It should be affordable. And then I think you'll see insurance cover the unexpected, the expensive, and the rare, and it will serve as a complement to people's day-to-day needs. But most importantly, I think you'll see the change where people will fight to put patients in control and build the healthcare that they need and they deserve.
Thank you, Zach, for a fascinating conversation. Thank you to Ro for making this conversation possible. Over to you, Caitlin.
Thanks, Jim. Joining us now is Mario Schlosser, CEO and co-founder of Oscar Health. Thanks, Mario.
It's great to be here, Caitlin.
So let's just jump right in. What trends are you guys seeing in telehealth now that we're about 4 months into this pandemic?
Yeah, so let me start slightly pre-pandemic. So at Oscar, we believed in telemedicine since our founding in 2012, and we were, I think, the first insurer that made telemedicine totally free. So that led to a situation where we had about 30% of members using telemedicine each year, even before the pandemic. And it sort of meant that about half of all UTIs, urinary tract infections, were solved through telemedicine, actually. Once the pandemic came, that about doubled. So in places like New York, boom, about 100% up there in terms of telemedicine utilization of our own telemedicine platform. And that's kind of now come back in a place like New York more to the baseline, but it's still about 50% up in all the places now, Florida, Texas, where the virus is still raging. Fortunately, New York has gotten a bit through the first wave there. That number one reason for using our telemedicine became prescription refill, which is one of those things you can easily do virtually, where was a great service that we had that right away. And about 20% at the peak of the pandemic of the telemedicine conversations we had were about COVID. That's also now kind of fallen back, but crept back up in the last 2 weeks or so, because obviously in the rest of the country, there's still a fair amount of utilization there. Now, the interesting thing is really what happened to the rest of the healthcare system that we as an insurance company pay for. And that was really quite fascinating as well. Across all visits we should have had, if we compare pre-pandemic to now the pandemic periods, you look at 100% of visits that should have occurred, 20% shifted to virtual, 30% remained in person, and 50% simply disappeared. That's sort of like really the before and after comparison, pandemic pre versus pandemic, kind of as we're in the middle of this now.
Wow. And so, yeah, now that we're looking into the kind of short-term future for the next year or so, or however long it takes to ride out this pandemic, how do you expect those trends to take place over the next year?
Yeah, so I want to again start with our own data here, kind of the comparison of the visits we would have expected without the pandemic and then those we actually got. And one very instructive data set to look at is, how does this work specialty by specialty, condition by condition? And so what we see there is that behavioral health in this period now has been the sort of like most virtualizable condition. Almost like 60% or so of behavioral health that's been happening in the pandemic has been virtualized. A lot of it shifted really to virtual and digital and away from in-person visits. Even for a fair amount of chronic conditions like diabetes, hypertension, hypothyroidism, and so on, you had about 40 to 50% go virtual of those visits that remains. So what that shows you is that there is a pretty big chunk of healthcare that you can virtualize and that members would want to see virtualized, and that you would want to continue to see virtualized. There's obviously some you can virtualize. The single biggest category that remained in person is maternity care for obvious reasons, and certain surgeries and so on you can't virtualize easily either. And so I would fully expect the future of the healthcare system, and I mean the very near future, to remain at a larger degree virtual than it's been in the case in the past. Now, of course, we got to watch out for is that, to go back to the kind of the first thing I said, about 50% of care simply disappears, and about 30% of surgeries disappears. And so if we look at our own authorizations of surgeries, they're still below baseline, and we got to come back to making sure that the outcomes remain, the quality remains, and people come back to the physician, whether virtually or in person, to make sure that chronic conditions get managed and so on.
Right. So let's zoom ahead to whenever this pandemic ends. Hopefully it's sooner rather than later. What do you expect happens to telehealth then? Do you think we go back to pre-pandemic status quo, or is this more of a permanent shift?
Yeah, I think there's a couple of things that are going to happen there. So I certainly think from my point of view, what we were going to be building in the next 3 to 5 years, I kind of think got compressed into really 2 months or so. The big thing we at Oscar can do that'll be difficult to do for just vendors in the space is we can combine telemedicine very deeply with our benefit design. And we can make sure people get driven more towards high value, longitudinal, at-risk telemedicine in the way in which I think it'll be a big part of the future healthcare system there. I think one thing to watch out for, of the many things to watch out for, is that we got to watch out that this doesn't become inflationary. Shift towards digital is a big opportunity of getting cost out of the US healthcare system, not to create more cost in the US healthcare system. And one very interesting statistic for us, and actually for the broader country, this is a CDC statistic, is that ER visits are down 40% in the pandemic, but ER visits with kids under 10 years old are down 80%. And so what that likely suggests is that a lot of these ER visits weren't really very emergent, right? I have a 6 and 7-year-old. I used to run to the ER when they had sniffles as well. I hate to admit it as an insurance company CEO. So we got to make sure that this shift towards digital doesn't create more utilization, but appropriately shifts utilization that should have otherwise happened. And so, long story short, I think there'll be a blended approach, as much care as possible virtual first, and then carefully orchestrated throughout the rest of the system for those things that got to remain in person. And I'll leave you one more stat there. About half of the shift towards telemedicine in the pandemic is still in the system, and it's pretty consistent across age categories. So this old saw of the young folks use it, the older ones don't. You don't see that in this shift towards digital that you've seen in the last 2 or 3 months or so.
Interesting. And so when we talk about healthcare, there's the patient side of it and there's the business side of it. During this pandemic, telehealth visits have been paid for at the same rate as in-person visits. Do you think that's sustainable?
I don't think it is. And I think this is going to be the sort of like place of a battle to come. And it's already kind of raging out there. So there's a huge opportunity in bending the cost curve in this shift towards digital and virtual, without a question. If we don't use that window, then a pretty big opportunity of shifting or bending the curve goes away. That'll either mean that telemedicine will get reimbursed lower than in-person care, which would unchecked bankrupt a bunch of providers, or it could mean, this is my favorite solution, that in the shift towards digital, you also have a commensurate shift towards at-risk care delivery. So providers who've been at risk in this pandemic have actually had their business held up pretty well. And so in my opinion, this will be a big shift, ideally towards risk. Otherwise, it'll rub very, very tough in the sort of like gears of the healthcare system in this sense.
Right. So normally we end up with one fun thing, but I want to add one hopeful thing to our kind of reservoir endings here. You live in New York City, which just celebrated its first day without a COVID death since March. Real quickly, how does that feel?
I missed the 7 p.m. cheering for the healthcare workers. That was always fun. My kids loved that, going to the windows and cheering there. It feels ominous. It feels in the sense that we have not gotten through this pandemic. We have simply survived, obviously, sort of like what is the first half of the first wave, I would say. The rest of the second half is still raging in other parts of the country. I truly hope that in the healthcare system, in our professional lives, in our personal lives, we can use this opportunity of really sort of like rebooting what doesn't work. That's the most important thing. I'm growing my hair out. That's one way I can, which you can reboot personally, perhaps. But in the system, we got to embrace a shift towards digital and virtual, longitudinal relationship with patients and doctors over virtual, and shift towards risk. And I think that makes me very hopeful that we can grasp the opportunity there.
Well, thank you very much for joining us, Mario. And now we're going to bring back Mike Allen for one final Why It Matters segment.
Well, thank you, Caitlin, and thank you, Caitlin, and we thank our partner Ro for making these conversations possible. Why it matters, Caitlin, a very interesting phrase that Mario used in that great interview you just had was virtual first. Do you think that's where telehealth is headed after this pandemic moment, or how much do you think will be durable?
I think that depends on two things. First, it's how much do people like telehealth? And of course, what kinds of care are they willing to outsource to being virtual? I had an experience myself with telehealth early on in the pandemic. I wanted to talk to my doctor about a potential coronavirus exposure I had had, and it was really easy. It was easy to have that simple conversation one-on-one on my computer. Then again, while that was convenient, there are other circumstances where I can imagine I either wouldn't want to do it in person or I couldn't, say if I need lab work done or something. So I think it depends how we kind of work out these questions and what people want. It also depends on the business side of things. How does this get paid for, and what does this do to existing providers, hospitals, insurance companies, et cetera? Because this would be a massive shift, especially if we reduce the amount of that telehealth visits are reimbursed compared to in-person visits.
Caitlin, you've been following the evolution of telehealth for years. You give great coverage in your morning newsletter, Axios Vitals, which covers healthcare. Proponents of telehealth say this is going to give us greater access at less cost, and it's not going to hurt outcomes. That sounds too good to be true.
And it might be. We don't know yet. These are all great questions that are kind of outstanding. Is first of all, I think we discussed all of these at some point today. But first of all, we look at access to just the internet. There are underserved communities, technologically underserved communities throughout the U.S. And if we move to telehealth, what happens to them? What kind of access do they have to virtual care in terms of reducing costs? I think that we just touched on that with Mario, where there are, and again, as I just said, there are providers that do not want to be reimbursed less for telehealth versus in-person visits, because then, of course, that means they get reimbursed less overall for doing more telehealth. And in terms of outcomes, I don't think we have enough data on that yet. Especially as I was just saying, it depends what kind of care you're looking at. What kinds of specialties make sense to move to telehealth, virtual care, versus what do we still need to do in person for that care to be successful? And I think that we're kind of in the middle of this grand experiment trying to answer some of these questions. And I think it'll probably be pretty illuminating as we decide what the future looks like.
Caitlin, believe it or not, it's 4 months since we walked out of the Axios office, 4 months that the United States has been really in the grip of this pandemic. As you think of the tech-related coverage that you've done over that time, the collisions between tech and healthcare, what technology has emerged in this pandemic moment, or what role has tech played in the pandemic that would be interesting to our viewers?
I think the first thing that comes to mind that's been fascinating to watch is the role of tech companies trying to get involved in contact tracing. And I know that we at Axios, with our partnership with Ipsos, we did a lot of polling on this, just how much people trust tech companies to give them their personal information about where they've been, who they've seen, et cetera, and just the privacy concerns there. And, I think it's just kind of an interesting snapshot, because contact tracing was posted as this vital tool that we need to do to defeat the pandemic, and your privacy concerns were still very prominent. And so I think it was just kind of a little, maybe, I don't know what it says about the future of technology and healthcare in general, but I think that we all do need to be aware that people do still care about privacy, and convenience isn't always going to win out over when you're kind of having these competing concerns.
Yeah, Caitlin, that seems like a unifying concept between telehealth and other technologies. You were talking about the top. about your own personal experience, and that is trust, right? And it sounds like you did trust the technology. You did trust that your conversation would remain private.
Right. And it was kind of a simple encounter. I went to my doctor that I already knew and used, and it was just, I clicked some link and I was face to face with this doctor via screen. And so I don't think it was the same thing as handing over my data to say, whatever tech company is trying to develop a contact tracing app. But as telehealth becomes more involved, I imagine it would become more complicated and more tech players will get involved in that space. And so, I don't know how much people will trust each individual component of that.
So Taylor's giving us the hook. So we'll do our own one fun thing here. Caitlin, at the top, we had a little spoiler that today's your birthday. The FCC chairman wished you a happy birthday. I know you celebrated with your family last weekend. Thank you for spending your birthday on an Axios virtual event. What are you going to do to spoil yourself now, or how are you going to celebrate for the rest of the week?
Well, thank you for the birthday wishes. My sister made me a peanut butter Reese's cheesecake over the weekend, so I'll probably eat some more of that and have a good dinner, and you just kind of hopefully try to wrap up vitals early and relax.
Contact-free Reese's cakes. That's the moment that we're in. Caitlin Owens, thank you for your expertise, this great conversation. We'd like to thank the Axios events team for making this possible. Thank you to our partner, Ro, for these great conversations. Thank all of you for tuning in, and I'll see you on Axios.com.